Finally, Karin Smyth, you are the prospective MP for Labour for Bristol South. There are other parties available,
really?
but with a small p, as it were, for the politics. Could you draw on your experience in the health service about where you see the future in terms of tackling this awful dilemma?
Thank you. Sorry, can everyone hear that? I thought we were going to be speaking over there, so I wasn't quite... Is that okay? Can everybody hear me? I mean, for me, first of all, I think we should thank the Bristol Festival Ideas people and Peter for putting on this debate, because I joined the health service as a manager in 1988, and I was first introduced to the politics of healthcare at a social policy course. And I was introduced to the Black Report into Health Inequalities. That's what galvanised me to join the health service. And there is very little real debate about the health service and about the politics of healthcare in this country. There's a lot of platitudes thrown around, but there's very rarely a good quality debate. So I think they've done really good in the last couple of days to get this going in Bristol, and I hope we have more of it. But for me, the discussion is located in 60-odd years, because I think I did a politics degree. So we had 30 years of state planning, we've had 30 years of the market, and I think we've kind of concluded that neither of those two things particularly work well. And for me, there is we need a real focus on three things, which are about having a more accountable system, one that does focus on prevention, and one that does look at the whole person. And I would agree with everything that's been said before. And I think one of the interesting things in the healthcare debate is actually we're all pretty much agreed on some of the problems. The thing that we learned through the Black Report is about the devastating effect of health inequalities. And although there has been a lot of improvement, those health inequalities do persist. The other thing we learned in the Black Report was how strong provider interests are in the health system, and how strong particularly the middle classes are in making the health system work that benefits and perpetuates some of those health inequalities, actually. But in things in terms about funding, we do have cross-party support really for the funding model. And the public support for a taxation-funded, free at the point of need service is very, very strong. Last year, the King's Fund ran a series of consultation events with Ipsos Mori around with the public about how we should pay for healthcare in the future. And again, support for that funding model remained very strong. But the question is, they asked one key question for politicians was that people really needed convincing that the current system was running as efficiently as possible before they would think about a change in funding. And the question is, should we persuade people they should pay more, not out of their credit cards, but actually out of, as Peter says, as Ron said about, out of gross domestic product. And I have to tell you that really the NHS is not yet the biggest political issue facing the people of South Bristol. The availability of decently paid secure work, particularly for the young, housing, those are the really big issues. And it is difficult to ask the people of South Bristol to pay more for an NHS that I know does not make the best use of the resources it already has. And crucially, a health service that does not actually have the responsibility for the problems that people are particularly facing and the problems that create poor health. And we know from things like the Marmot Review again in 2010, there's plenty of public health reports suggesting that the lower one's social and economic status is, the poorer one's health is likely to be. And the thing that I think is particularly affecting us now, and I think where change will really come from, and I was able to sit in on this session earlier about caring, because we do talk about generational changes, don't we? I think we've had the market, we've had the state planning for 30 years, we've had the market, and I think we're on the edge of something quite special now. And I think that change is going to come from us, the people that do use and pay for the system that we know isn't working. Because out there is an army of people caring for people. And that army is overwhelmingly female. They grew up expecting the system to work well for them, and they know that it isn't. There are 4 million carers of working age at the moment, 57% of the women, and 1 in 5 people give up for caring. And I know some of you sat in the earlier session, and there were some really important tales that we learned again in that session. There are lots of high-profile reports into the inadequacy of social care and community care at the moment, but there is very little agreement about what that future model looks like. In my view, the system does need to be more accountable, it needs to focus on prevention, and it needs to treat the whole person. And on accountability, I do think it's hard to ask the public to pay more without going to a transition to an illness-preventing system. We do have to think beyond the general election debate about how we make decisions about the allocation of resources in the system. I think the events in Scotland have been really interesting recently, that actually when people when they are motivated by something they care about that really impacts them, then they will really engage about how they want to be governed. And I think it is time we started to treat the people who love the NHS, who pay for it, as equal to the professionals that run it. And I think we need to start giving people some power in how the system is run. And technology will help. As Jonathan said, people should absolutely have better access to their records. There should be much, much greater shared decision-making on treatment. But we must really also harness the great energy and vitality that is in our communities, particularly here in Bristol, to come up with some of the solutions. And we need to start looking to patients as assets and not nuisances. I think we know that there are difficult decisions to be made in the NHS, but actually the NHS is not very good at making difficult decisions. And although they were local, the former health authorities and primary care trusts, and we knew who they were always largely accountable to Whitehall. And it's a thing we don't talk about that often, but one of the, the professional bodies, doctors and managers all really look to Whitehall, both in their professional or national organisations, in their own professional development and accreditation. Managers are very much protected from local democracy in the health system. And NHS careers are largely advanced on a national level. And I think the other compounding factor we have that following the Act, the 2012 Act, nobody really knows inside or outside the health service, who is responsible for difficult decisions. In fact, people don't know who's responsible for most decisions. And I think, well, he seems to be the only person that's not to blame for what's going on in the health service. But we need to look about who does make good decisions, who is better at making difficult decisions. And the truth is that I think local government is actually quite good at making difficult decisions. And it's not a particularly popular view in the health service. It's not always a popular view in the Labour Party. But I don't think we are going to get the sorts of changes unless we do work much more closely with local government. And the health and wellbeing boards that were set up under the Act, they're not working well, let's be honest, but they are very well placed to make the best use of the local government experience, particularly around health inequalities and the drivers of that health demand. And I think we need to look at those. I could talk forever about preventing health disease, but I had prepared more facts, but I won't bore you with all of those. The road is well travelled. There's a lot known about where the demand comes from on healthcare. And when we talk about those increasing demands, of course, a lot is to do with getting older, but an awful lot of that is much more preventable. And again, the Marmot Review in 2010 estimated between 36 billion and 40 billion pounds lost revenue through taxes, welfare benefits and cost to the NHS of health inequalities. That's a lot of money. The most important thing that I will start to see is, I think, is looking at the whole person. And again, I think everybody's mentioned this. People, as Andy Burnham regularly says, their mental, physical and social needs. The system has to look at the whole person in the future. It has to be located much better in our local communities and support those who are supporting people in need. We have difficulty defining what is a social need. We have to talk about what is entitlement, as Peter said again, to health and social care, about national care service. But we again need to support the innovation and collaboration that does exist at local level and does exist across the country. There will be no top-down imposition. I'm sure you've heard it from Andy Burnham as often as I have. There won't be a top-down change for the Labour government, and actually there doesn't need to be. We are evolving towards different provider and purchasing models all the time in the health service at the moment. Every month seems to see a change in functions between the different parts of the system. There's a new directive. I think it's actually becoming every week at the moment, because this is, as we talked about at conference reason, this really is the reorganisation that never, ever ends. We have to stabilise the system. We do have to stabilise the system. There will have to be some changes, but we have to unleash that innovation that we've all got. It's going to take a long time to change the health system and the health and social care system, but I do think, and I credit to the Labour Party, I think we have opened the debate on funding, acknowledging the system needs money, and a refocus towards the whole person. And it's a debate that I really, really welcome. I think that, as I said at the beginning, the debate has been very poor. It is incumbent upon politicians to start leading a more honest debate publicly, but it is also incumbent upon all the players in the system, and that includes you as voters and you as patients and you as citizens, being very honest about some of those discussions.
Before we open it to the floor, we had a suggestion this morning from Bristol's mayor that we should have more power locally, and the suggestion that perhaps some of this health money could be used, let's say, for your prospective constituents whose real worry is about housing, and that could be fueling their mental anxiety, which we know is a big drain on the health service. Are you suggesting that's an option that we could explore, using health money in a different way?
Well, I think we've got something called, I don't know whether you talked about it this morning, the Better Care. Is it called the Better Care Programme this week rather than the Better Care Fund, which it was called last week or the week before? The Better Care Programme, which, I really welcome. I think, this is one of the interesting things about the politics publicly and the what's happening privately, if you like, in the system, because although Jeremy Hunt says nothing about the health service, that's the whole point, but actually coming out of the government is a lot more drive towards more joined up care and more joined up working with local authorities, of which the Better Care Programme is the first sort of pioneer. And different parts of the country are putting quite a lot of money into that fund, but it's not new money. It is health money going to a joint pot, and there is a lot of concern, particularly in the acute trust, and I'm sure Ron would want to talk about that, about, well, the acute trust are really struggling and taking money out of there that's not proven to have a benefit, actually, is a really tricky thing to do. Do you need a transition to help some of that? But that's the direction. I think the money is a real problem.